Hello, this is Elizabeth Hugo for the Ethics in Society podcast. I'm here with Dr. Brian Mustanski, who is the director of the Institute for Sexual and Gender Minority Health and Wellbeing, and associate professor at the Department of Medical Social Sciences at the Northwestern University Feinberg School of Medicine, and the co-director of the Third Coast Center for AIDS Research. Hi, Brian. Thank you so much for joining us today.
Hi, Elizabeth. Nice to be here.
Your background is, it varied, but today if you could talk a little bit about your experience with young MSM research and why research on research ethics is important in this field and what we can gain from empirical research on research ethics.
Yeah, so most of my career has been focused on addressing issues of HIV prevention amongst adolescent and young adult gay and bisexual men. And, the data from the Center for Disease Control, the epidemiological data we have in the United States has been showing for at least a decade now that young gay and bisexual men, meaning those 13 to 29, are some of the only age groups in the United States, the only risk groups in the United States that are showing increases in new infections. We've seen really dramatic increases for a long time, particularly in Black young men who have sex with men, more recently in Hispanic young men who have sex with men. Some of the simulations suggest we'll soon be seeing increases, or we may soon be seeing increases in white young MSM as well, or MSM being men who have sex with men. And so, it's a really alarming situation that young people represent an increasing proportion of HIV in the United States, and that amongst young people, 80% of infections are in transmissions from men to men. But, you think when you see those very alarming numbers that you would see all sorts of prevention programs, all sorts of research focused on this population. And unfortunately, that's not what we see. We see that the CDC has its list of evidence-based interventions, which community organizations and health departments need to draw from to do HIV prevention programs. And we don't see services for young men who have sex with men. We don't see programs, evidence-based programs for that population.
Great. So they're disproportionately contracting, but not represented in the research. And this is a justice ethical issue. So what are some of the things that you are doing or that you would recommend doing to move this in the right direction?
Well, I think that the reasons for lack of science, the sort of what I've described as a scientific inequity that's driving this health disparity, is that people do have concerns about adolescents being in HIV research and sexual health research. And we need those deliberations, the considerations of how to best involve adolescents in sexual health research to be informed by research. It should be an evidence-informed process of what are the protections that we can put in place. How can we do the consent process in a way that will assure that the adolescent participant understands what's being asked of them, what the risks are, that they can make informed decision about what's in their best interest. And research ethics is the way to get to that position, to try to understand how we can maximize the protections and the informed consent process for young people.
Great, thank you. So you are actually a co-PI on a grant with our center director, Dr. Celia Fisher, the ASAP project, Adolescent Scientific Access Project, I believe. Could you tell me a little bit about that and what you're looking to find?
Yeah, so the ASAP project is really focused on understanding adolescent perspectives on participation in HIV research, and really all phases of different kinds of HIV research. So how do they feel about the recruitment process? How does a young person feel when they see an ad in their Facebook feed about participating in HIV research? What are their thoughts about the consent process? How can we help them best understand the risks and protections? What do they feel are the risks of being in different types of research? So what do adolescents feel are the risks of being in a survey, in a study that has HIV testing, in a survey where they might be given access to PrEP, and the study might be about how we can improve their adherence to PrEP, for example. Really eliciting the perspectives of the participants who are actually going to be in those kinds kinds of studies to understand their perspectives. How do they feel about post-trial access after the study is over? Should the doctors or the researchers continue to give them access to the medication? These are all things that we have shown through our the qualitative research that we've done so far, that adolescents are very impressive in their understanding of and appreciation of the risks and benefits. They are able to understand randomization, why you would do randomization. They are able to understand that after the study is over, the researchers may not be able to continue to provide PrEP medication, but should be able to give them a referral and help link them into care. And they feel negatively about the ideas of their parents being involved, or that they're required to get their parents' permission, that most of the adolescents in the study said they wouldn't be willing to be in this kind of research if they had to get their parents' permission. And for reasons that are really, unfortunate to hear. They talk about being afraid of getting kicked out of the home because of their sexual orientation, that the parents have told them they don't ever want to talk about them being gay again. And so, if your parent tells you when you come out to them, don't ever bring this up again, you're not going to bring home a consent form asking to be in a study for, young gay and bisexual men.
Wow. Thank you so much for all of that. That's great insight. And thank you so much for being with us at the Institute.
Thank you for having me.
Take care.